Hello students, we will discuss a small tube instrument which is used commonly in surgical field. So identify it with a brief discussion. What is this tube? This is, look at that tube with the flower-like arrangement. This is Malecot's catheter. What is it? It is self-retaining catheter. Now urinary catheters are classified basically as self-retaining like Foley's catheter and Malecot catheter, and non-self-retaining like mainly simple red rubber catheter. And this is a type of good old self-retaining catheter. Malecot was an intern when he modified red rubber catheter into a flower and made it self-retaining. This way his name is coming to the picture. Originally it is red rubber. Now different newer materials are used to make the Malecot catheter. Now it is mainly passed per suprapubically, not per urethral. Above the pubis, in a patient with the retention of urine, once patient comes to you for any reason, maybe BPH, trauma, whatever it is, you have to pass a Foley's catheter to relieve the retention. If that fails, red rubber catheter, or you have to pass metal catheter. That also fails per urethral, then you have to do suprapubic cystostomy. Now tube used is Malecot catheter, or modified versions are available currently. Percutaneous trocar Malecots are available, different thing. But version is same, Malecot catheter. It has got a stiff tubular structure, wide lumen, and here is a flower. You can see that, like this, like this, like this flower. And it's stretchable. When you stretch this one with an artery forceps, it becomes like this, like this. When releases, it becomes flower. So make an incision, confirm that bladder is full. Clinically by percussion, infraumbilical area it will be dull, or after that do an ultrasound and reconfirm it. Give a localness just above the pubis and make a small incision of 2 cm and skin subcutaneous tissue, anterior touch is opened. Then you can directly in the extraabdominal space push the peritoneum above or the dome of the bladder, pass a needle and aspirate the syringe and aspirate, confirm that it is urine and urine only. You can see the crisscross detrusor fiber. Then put a stay suture using Vicryl or catgut. Then hold it properly. Then make a small incision, urine comes out. Then place this with an artery forceps, this Malecot catheter stretch like this, stretched, and push it inside. Release the artery forceps, flower opens up, becomes self-retainable. Then fix it to the urinary bladder using absorbable suture. Then fix it to the rectus sheath. Then connect to the urobag. So there is how exactly will pass it. It is not passed per urethral because with the flower you cannot pass it. It will traumatize the urethra. Per urethra, Foley's catheter is the ideal thing. But it is self-retaining. You can keep it for a long time. It won't get blocked. It won't get infected. It drains fluid adequately. There are other areas where you can use the Malecot catheter. Wherever in a big cavity, pus is there, like psoas abscess, perinephric abscess. Just a few examples, or appendicular abscess. Abscess anywhere. Large cavity is there. Once you drain, you can put this catheter and come out, so that continuous drainage to have. So what are uses? Urinary retention I already told, as urinary diversion, anywhere urinary diversion, major surgeries and other things can use it. To drain pus in various cavities, any abscess cavities. Drain cavities after surgical procedure. It's a big cavity and a big surgery here. We can put a Malecot catheter and come out. What are the advantages? It drains urine and fluid completely, I said. So it drains completely. It won't get infected, unlike Foley's catheter. Less common to get blocked. It's a very stiff. It contains sulfur, very stiff material. Can be kept for longer period. Another advantage is once track is formed, maybe after 1 month or so, you can remove that one, stretch it and remove it, and put one more one. So you can replace with the one more tube later period. Many patients, especially in urinary diseases, they will have long-term suprapubic cystostomies, SPCs. So you can replace the SPC after 2 months, one more, like that. So replacing with the newer one is quite easier. Long time we can keep. All these things are the advantage of this tube. But remember, it cannot be passed per urethral. This point you have to always remember. It is always for SPC. Basically, it is designed for suprapubic cystostomy. Remember, cannot be passed per urethral. That is the important thing. Per urethral, Foley's catheter is used. That point you have to remember. So students, go through my clinical book, which contains videos of examination and all methods of examination, including instruments. Go to my SRB surgical manual in detail about surgical principles of everything, including specialities. and go through my operative procedure, detailed voluminous book. You can any surgical technique we have learned from this. My tissue approximate, with suturing technique also with the video. That book is also very good, even though small book. And my DigiNow covers everything. 220 lectures are there from A to Z, including clinical examination, basic operative surgery, and instruments, pathology specimens, X-rays, everything, specialties, neurosurgery, cardiothoracic, urology, briefly what is needed for undergraduates and postgraduates. Everything is covered. Please go through those lectures and materials to have a better idea. And also go through my online different websites, which you can always go through and have videos of different lectures. So students, I hope you understood well. Thank you very much.